Hi, my name is Rena Cochran. I'm doing my health history and focused assessment for nurse 385 in workshop 7. And this is my friend Lisa. She's going to be my patient today. You want to go ahead and read that?
I understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on Blackboard for access by faculty and students to be at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the students, are not considered liable.
Alright, let's get started. Can you tell me your name and birthday?
Lisa Cochran, November 22nd, 1960.
Okay, so that makes you 52.
Yes.
Alright, and why are you here today, Lisa?
I've had a lot of lower back pain and tenderness in the front, and I feel like I have to go to the bathroom all the time, and it's just very painful.
Very painful. What would you rate that pain on a 0 to 10 scale?
Probably about a 7.
7. Okay, and when did this start?
Last night, about 10 o'clock.
10 o'clock. Okay, was there anything you were doing to try and help that pain?
I try to drink a lot of water, and I've been told before cranberry juice, but it didn't. I mean, it eased it a little through the night, but
nothing. Okay. Alright, well I'm going to go ahead and get a history on you before we do your focused assessment. So, how about allergies? Do you have any drug allergies?
Compazine.
Okay. And your home medications?
I take Zyrtec D every day.
Okay. And that's all?
Mm-hmm.
Alright. How about an emergency contact?
Jeff Cochran.
Okay. And who is Jeff?
My husband.
Okay. So you're married. Do you have any children?
2.
2. And what's their ages?
22 and 24.
Okay. Are you currently employed?
Yes.
Alright. And where's that?
Our Lady of Mount Carmel School in here.
Okay. Is that the Catholic school?
Yes.
Alright. Do you attend church at that school?
Yes.
At that church? Okay. Is your faith pretty important to you?
Very.
Very important. Okay. Are there any cultural, spiritual, or dietary preferences that we need to be aware of?
I mean, if there happens to ever be an issue, I would like a priest to be called.
A priest to be contacted. Alright, so you're a teacher. Where did you attend college?
At Southern Illinois University in Carbondale.
Okay. And are you from Southern Illinois?
Yes, I grew up in Dow.
Okay.
I currently live in Elgin.
Alright. And how do you feel about your current health status?
Fine. I mean, everything except for the occasional problems with the allergies. Everything else in menopause is about
Okay.
it.
Alright, Mrs. Cochran, do you have any advance directives?
No, not yet.
Okay, how about a POA or a living will?
No.
Alright, are you interested in receiving any more information on those?
Yes, I will.
Okay. Alright, now let's review your nutrition. Would you say that your nutritional intake was adequate or poor?
I mean, I have an irritable bowel problem, so I eat plenty of fiber and
Okay.
no high fatty foods. I don't eat. So.
Okay.
Yes.
How about your water intake? How much water do you drink a day? How many
Probably
glasses?
around 6 glasses a day,
Okay.
probably. Water and tea, iced tea is about all I drink.
Alright. Now how about your history? What about your medical history? Any head, eyes, ears, nose, or throat?
Well, I wear glasses,
Okay.
or reading glasses. I had a tonsillectomy when I was 11, 71, I think.
Okay. How about respiratory?
I have asthma. I don't know, when I was younger and played sports, I had problems with asthma.
Okay. How about a cardiac history? Any heart disease?
There's heart disease on actually both my mother and father's family have heart disease.
Oh, do they? Okay. How about you? Do you have any gastrointestinal issues?
Irritable bowel.
Okay. Now, I know you're here on complaints of a UTI. Do you have any other history of urinary issues? I have here a kidney infection in 2010.
Yes,
You were
I
treated
did.
for that here?
Yeah,
Okay.
and my grandpa had kidney disease, and my aunt. So yes, I did have a.
Okay. Um, how about reproductive history? You said you were currently in menopause, is that correct?
Yes.
Okay. How about a musculoskeletal history?
I've had what is it on the spine? It's curved.
Scoliosis?
Yes, scoliosis.
Okay. And were you treated for that?
Yes, I wore a brace in junior high.
Okay. All right. Any neurologic history for you,
I
or
can think of.
okay? Do you have any diabetes?
Diabetes was on my great grandmother.
Okay. How about your immunizations? Are those up to date?
Yes, I just had, I believe it was 2009, a tetanus.
A tetanus shot. How about a flu shot? Have you had one yet
I
this
get
season?
yearly flu shots.
Yearly flu shots. Okay. Would you be interested in having one of those?
Yes.
Yearly? Okay. How about an anesthesia reaction? Have you ever had?
I did
Okay.
when I had that surgery when I was young. I had it.
Okay.
I couldn't breathe with the anesthesia,
Okay.
so I was allergic.
All right. Any other family history? I know we went through a little bit of it.
I have an aunt. My aunt and my sister have colon cancer.
Colon cancer. Okay. All right. Well, I guess we got a good history. So now we'll focus on the suspected UTI. So you said you had low back pain, burning upon urination. Does your bladder feel full even after you go?
Yes, all the time.
Does it? Okay. So that might mean we're retaining some, right? And it's tender, about a 7 out of 10? Okay. How often are you going?
Oh, I mean, definitely, I feel it every 30 minutes or so. It just feels like I have to go. I'm actually going probably every 3 hours.
Okay. All right. And did they get a urine sample before you
Yes.
came into the? Okay. All right. Well, I have your vital signs here. They all look pretty good. Your temperature is 98.3. Pulse is 72. Blood pressure 124/70. Your respiration's 18. Those are all normal. And it shows here that you've recently been on Macrobid for a UTI.
Oh yeah,
Is that right?
2 weeks ago I had another urinary tract
Did you?
and it cleared up. I was on that. I don't think I actually finished it.
Okay.
It cleared up and I forgot all about it.
Okay. Did they explain how you're supposed to go through the full course of the medicine even after symptoms
Yes,
resolve?
and
Okay.
I know that. When it cleared up, I forgot to finish the bottle.
Okay. Well, the reason being is we're getting more and more superbugs, so if we're not finishing the antibiotics, our body can be resistant to them, and they won't work the next time we try them. Okay. Well, you said you're in menopause, and a lot of times the estrogen levels can cause reoccurrent UTIs. There are some ways to help prevent them. You said you drank 6 glasses of water a day. The text recommends 2 to 3 liters of water a day.
Oh wow.
If you empty your bladder regularly, which is at least every 4 hours, that keeps the urine from remaining in the bladder where the bacteria can form. And also, 50 milliliters of pure cranberry juice each day can help acidify the urine and keep it from
So
causing bacteria.
just each day, regardless if I have a urinary tract infection, it helps?
Mhm.
Okay, that's good to know.
Yeah. Well, all right. I'll get your lab work in, and I'll have the doctor come see you.
Okay,
Thank you.
Thank you very much.